Welcome to our seminar. It's not a seminar, it's a webinar, sorry. And the main hosts are Dr. Liakas, who is our medical director at Vie Aesthetics, and Nicola, Wookey, our advanced nurse practitioner, who is also a menopause specialist. And she will be talking about our clinic and the client journey today. So what we have actually in place to help serve our community and support women who are going through perimenopause. So a few things about us. We are a CQC regulated doctor-led clinic. We have won quite some awards. People who come into the clinic see them behind the reception. It's a good way for us to check ourselves and keep ourselves in line and know that we're doing something right. We're very passionate about health, wellness, and image and confidence. So we see what we offer in a holistic way, and our strength is our personalized, tailored treatment plans, because we have all the latest technologies that are non-surgical, but also health care services and also screening, DNA tests, and so on under one roof. So the whole team works together, and this is why we can offer many services that are working synergetically, and they're interrelated, from hormone therapies to wellness protocols, IV drips, vitamin boosters, and then aesthetics treatments, looking at skin, laser, anti-aging, and regenerative as well. Our theme tonight, I'm going to actually now hand over to Dr. Liakas to continue.
I shouldn't be the one talking about menopause and perimenopause. Can I just say, though, this is what I want the female participants of this webinar to remember, is being perimenopausal and menopausal is a normal phase of human physiology. So there is nothing abnormal about it. We medicalize the condition because we can offer help, but it's not a medical condition. It's nothing abnormal. And actually being menopausal means that you have a wonderful life and you've reached that stage of maturity, which obviously is menopause as well. And talking about menopause, it's not just women. Men get something similar, but obviously this is not the theme tonight. Maybe at some point we'll talk about the male menopause as well, but not tonight. Tonight, females are the center of attention. But yeah, remember, this is not an illness. It's just a normal condition of human physiology. So the webinar tonight is to raise awareness. Again, the main thing, and what I want you to get out of this, the message is like, you're not abnormal, you're normal. It's just that you're having the symptoms of maturity. And obviously with this, we would like not only to tell you all about menopause and perimenopause, but everything else that encompasses this special period of your life. And also for you to know what's available, how you can help yourselves, not just from the outside, but from the inside as well. And obviously in this webinar also, and between yourself, share experiences and tell us how you got help, if you got any, or ask us questions. So obviously we support women, and as we said, Vicky already mentioned it, tailored treatments. That's anything to do with hormone replacement, anything to do with blood tests, anything to do with regulation of your bodily physiological functions, up to the point of like with beauty and how you look in your face, the body. All our treatments are medically supported and there is evidence based behind them. So what you get is state-of-the-art treatment as well as medical opinion.
Right, can I just check, is Nicola, are you on?
Hi, I'm here.
Okay, do you want to take it from here?
Sure.
Okay, so Nicola now, yeah.
Thank you, Dr. Liakas. Okay, so what is perimenopause? So perimenopause and menopause is when we've come to the end of our reproductive years and our body's no longer producing estrogen and progesterone. At this time, we do start to experience such symptoms of irregular periods, hot flashes, night sweats, dry skin, hair thinning, mood changes, brain fog, sleep disturbances, fatigue, course weight gain and vaginal atrophy, and discomfort during intercourse. how we treat this. So how we treat this is with hormone replacement therapy. HRT is the main option that's used to manage menopause symptoms. At Vie Aesthetics, we specialize in assessing what hormone you're deficient in and then prescribing HRT that's relevant to that. So part of the process is that you come in for a consultation. You're then given a blood test where we look at your progesterone, your estrogen. We also look at your testosterone levels, and then we look to curate a hormone replacement that would be most suitable to you. We also do look at your follicle stimulating hormone at some particular ages, because that's a very good indicator into what part of the menopause you're in, whether it's peri, post menopausal or menopausal. The hormone replacement prescriptions are issued after you've had a blood test and a full consultation. At that point, we have a chat about how you'd like to have your hormone replacement. So we have a large formulary that we prescribe from. So we can look at topical sprays, vaginal pessaries, oral types of HRT, or a combination of two. We then look at whether you're, if you're more likely to be having a sequential HRT, so a HRT where you would have progesterone for a couple of weeks and then estrogen for a couple of weeks, or to have a combined HRT where you have those hormones continually. We would start you on the HRT, then we'd get you back possibly 3 months later to see how you're getting on. And if you're getting on, then we could issue a 6-month prescription and just see you on a yearly basis. It's very well supported. Our patient journey is very different from the NHS because we do very individualized blood tests to look at exactly the hormone that you're lacking in, and we aim to treat that. We have myself on hand at any time to contact the clinic to discuss any concerns you might have. And we also do have some recommendations for biomedicals for those who are not suitable to have HRT for whatever reason. That may be a family history of breast cancer or so forth. That would have to be looked at on more of an individual basis.
Okay.
Thank
Do you want? Shall I go to the next one?
Yes, please. So when should you seek help for menopause, and how do you access our services? So you should seek help for menopause at any time that you start to feel that you're experiencing menopause symptoms. So theoretically, menopause is from 45 to 55, but in some cases it can be as young as 30 and as old as your mid-50s. Even women that are post-menopausal still experience menopause symptoms and can be suitable to have HRT. So my recommendation would be, if you're having any type of HRT, any type of menopause symptoms, to book in for a consultation and let us go through the pathway to see if we can help you. So one of the bullet points here is saying during menopause, some women experience greater difficulty than others. This is very true, and some women experience symptoms a lot longer than others. And this is all normal part of menopause, and these are things that we can help to combat. You can book in your consultations by giving us a call. You can book in line. You can send an inquiry, or if you're an existing client, you can just bring it up in your consultation with us.
Right.
I think Nicola can speak.
Do you want to cover the intimate health treatments as well, Nicola?
Sure, I'll cover them somewhat. It'd be good to have Dr. Liakas's input.
Yeah.
Okay, so of course, one of the major concerns with menopause is vaginal atrophy, and this is due to drops in your estrogen levels. So that's obviously a developmental hormone that's in control of our reproductive system. So one of the injectable treatments that we have at Vie is Deserol. So this is an intimate rejuvenation treatment, and this can be injected into the vagina to help with vaginal dryness. We also use it for skin laxity and looseness on the outside of the vagina. So this can be for a better appearance, but it's a very recommended treatment for vaginal atrophy, and it can also be used alongside such HRTs as pessaries or hormonal and non-hormonal vaginal lubricants. very, very common concern. Thank you, Dr. Liakas.
Yeah, the benefits, of course, of the external rejuvenation of the vaginal area for females. It's not only the aesthetic part. Obviously, hydration and elasticity improves just not on the inside, but on the outside. And of course, for example, hobbies like horse riding, cycling. Women that have this treatment find it's a lot more comfortable, because obviously the volume that people have in younger age, or females have in younger age, acts as a cushion for various activities. And a lot of people find, oh, actually, I can't do the sports that I was doing because it's very uncomfortable. So a lot of ladies that have this treatment with us, horse riding instructors, cyclists, so very sporty people that want actually to preserve this comfort in that area. Otherwise, they find it very uncomfortable. And obviously, with the dryness internally, what's very common in women once they've entered menopause is urinary tract infections. And working in the hospital as a consultant, I've seen lots of older women being admitted with urinary tract infections that are recurrent, and sometimes because they've taken so many antibiotics over their lifetime, they end up being resistant to antibiotics. But obviously, restoring the health as well as the hydration of the vaginal area actually improves the flora, so women will not be getting as many urinary tract infections with this treatment as well. So something to keep in mind as well. And of course, like, the whole thing is like a massive boost in the confidence and the quality of life of a person.
Yeah, and it's very often been referred to online, in articles, on social media, as the labia puff, the external.
Yeah, the external.
And it's not only aesthetically enhancing and boosting the confidence.
Functionally as well.
It protects the inner labia as well. Okay. PRP, did we cover this?
PRP is basically own blood therapy. PRP, I'm sure you've heard, it improves the blood supply on the facial skin, as well as a good treatment for hair loss, thickening the hair. Obviously, platelet-rich plasma therapies, we take your plasma, we spin it around, we take your blood, we spin it around, then remove the plasma from that, and the plasma can also get injected internally and externally in the vaginal or the intimate female area through growth factors and restoration of the fibroblasts and skin and so on. It's general, not only rejuvenation, but also restoring of the initial functions. Platelet-rich plasma therapy, in order to be effective, it has to be repeated about 3 times, once monthly, in order for somebody to get the maximum benefit from it. And polynucleotides is a new treatment whereby you inject, it's neither a filler, no Botox, it's a special protein that you inject locally to improve the texture of the skin and to restore the cells, in the sense that it reduces oxidative damage. What it means in lay language, it will de-age the skin and the area in that intimate area of the female body. So it's a completely different entity. If you search polynucleotides, the adverts will be mostly for the face, but it works in the intimate female area as well.
Yes, and one of the things, it's not mentioned in our presentation for tonight, but one of the concerns or issues and problems with women sometimes with menopause and the changes in hormones and the changes of the area is a lot of pain, dyspareunia, and loss of elasticity in the area, and basically not just difficulty, but not being able to be intimate. And there is another treatment that we use in those cases in conjunction with the filler, and that is Botox, to relax the area and then create the hydration as well. Okay.
Now, obviously, another thing that's happening with older age, and again, this is not affecting just females, it's males as well. There's hormonal imbalances, our metabolism changes, and a lot of people find that after a certain age, they find it harder to lose weight. I'm sure you've heard, especially it was 1 or 2 nights ago on BBC News as well. The government now asks GPs to prescribe weight loss injections or the skinny jabs for people that are overly overweight. Obviously, we follow also strict guidelines as to who can get these jabs. And obviously, we follow a similar pattern to the menopause clinic. Somebody comes, we do their blood test, specific blood test to make sure that the weight gain is not hormonal. They need to exceed a specific body mass index, and then we give them the injections. The injection in itself will suppress the appetite in a very natural way. And basically, people that self-inject in order to lose weight, what it will do, it will suppress their appetite to the point where they're going to start losing weight. We follow these patients monthly, and obviously one of the questions that we often get, what will happen once I'm going to stop the injection? We have specific protocols to follow in order for people not to put the weight on again, but obviously this is not for here to discuss. This is just to know that this exists at our clinic as well. So especially medical weight management for people that have put on weight, and we've identified this is also something that's happening more in perimenopausal, menopausal women. And obviously, one of the other components, and under the same umbrella, you can't forget that obviously the skin is your biggest organ in your body. The skin is affected by lack of estrogen as well. So it's not just the intimate area. There's more wrinkles, the skin is sagging, the skin is looking less vibrant, and there's many things that you can do to look better, from what everybody knows, Botox and fillers, to other things like chemical peels, collagen stimulating therapies, light therapies, microneedling, machines such as HIFU, and many other treatments. And in addition to that, one thing that you need to remember, apart from the skin, and obviously the hair doesn't differ very much from the skin, it's all keratin cells. Hair is thinning in females as well. And the main reason for this is because during menopause, the hormonal imbalance and the imbalance between testosterone and estrogen creates that sometimes male pattern baldness in females as well. And the additional part is also hair senescence. That means physiological aging of the hair. So even if ladies don't lose their hair in a male pattern baldness, a lot of females during menopause say, my hair is suddenly becoming thin, or it doesn't look as thick. So we have hair rejuvenation treatments such as PRP, stem cell treatments, polynucleotides, light therapy, also DNA testing to ensure that to give you personalized directions and prescriptions, what will work for your hairline. So we can help in that respect as well.
In avoiding hit and miss and experimenting.
So for the face, a V-lift, basically the V-lift is a combination of treatments that encompasses fillers, collagen stimulation and threads, and this is basically the packages for all the ages. So we suggest the V-lift midi ages 45 to 55 and over 55 maxi. It looks like a lot, but the one thing I need to say, when you look at these 7 mils or 6 mils of filler, etc., don't get panicky, because on our face, between the age of 20 to 50, we've lost about 18 to 20 mils of volume anyway, purely from the process of aging. So when somebody tells you you need 2 or 3 mils of filler, it's actually like still a drop in the ocean. So it's nothing to be scared about. And obviously, we're always here to discuss what would be the best package for you. Apart from this, we can boost your immune system, lack of vitamins. Another thing that's happening with growing old is sometimes malabsorption of all the nutrients. In addition to the fact that nowadays a lot of people get a lot of nutrition, but it's usually rich in carbohydrates and we get fat, but we don't necessarily get all the nutritional elements that we need. So in that sense, we can do your bloods, we can check what you're lacking, we can give you vitamin boosters in form of injection or intravenous infusions. And obviously LED light therapy is there because this is a non-invasive treatment. You're lying under a red light. This stimulates collagen, and you can use these for collagen stimulation of the face, for the body, as well as for pain management. And body contouring treatment, obviously body contouring, we can help you in many ways. HIFU, fat freezing, endolift, many machines we have to give you tailor-made treatments for all concerns that you might have, purely from entering the menopause phase of your life, or just moving from like a younger age to physiologically a little bit more older age. So basically just telling you that this is like a holistic approach to all the problems that come with age, basically.
In perimenopause.
In that region of
We're
your
all
life.
young. We're just perimenopausal.
So if you want to discuss or if you want to chat about us either tonight or via messages, tell us about your symptoms. If you've had any experience with hormone replacement, or if you're thinking of having hormone replacement and what, and obviously you can get in touch to tell us the symptoms that you got as a result of menopause, such as your weight gain, skin changes, or intimate problems.
Yeah. Thank you very much, Dr. Liakas, and thank you very much, Nicola. Now, these are some questions that we have there for tonight. If we can start sharing, you can do it in the chat, or you can just we can unmute you, opening your, doing your microphone, unmuting it, and ask the question. So we can talk about symptoms.